For stem cells.
Hi, good morning. It's Dominic from Shift MS. And today, the person who's been very kind to share some time with us is Phillip Anderson from the MS Society. Phillip, could you tell us more about what you do and why we're talking today?
Yeah, hi Dom. It's a pleasure to be here. Thanks so much for having me on. So I'm the head of policy at the MS Society, as you said. So my job covers quite a few different things. My team is in charge of speaking to the MS Society medical advisors, which is a group of healthcare professionals, which has helped us a lot during the pandemic to give advice on things like DMTs. And we also come up with policy positions on things we think the government and sometimes other people like employers should do to make life better for people with MS. And that's been a very, very fast moving picture during the COVID-19 pandemic.
Thanks for explaining that. I guess it's a little more of a government-based job. And that's why we're hoping that you could explain. There's a couple of terms which are really confusing, and that's clinically extremely vulnerable and shielding. We're trying to work out how they differ. Everybody has different ideas about this, and I was wondering if you could shed some light, please.
Okay, I will do my best, Tom, and it's certainly been confusing for everybody, but we have the luxury of asking questions of NHS officials and people like that. So extremely clinically vulnerable is the sort of very sharp end of the spectrum for people who we suspect, and it is hard to know for sure, but who we suspect based on clinical advice are more vulnerable or especially vulnerable to COVID-19. For MS, the definition comes from the Association of British Neurologists, so some of the most senior clinicians in the country. What they have said is that if you have significant problems with breathing or swallowing, for instance, if you need artificial feeding, then you're extremely clinically vulnerable. Also, if you have had alemtuzumab or Lemtrada, as it's also known, or cladribine/Mavenclad within the last 12 weeks, because your immune system's compromised temporarily, you would also be considered extremely clinically vulnerable. And then lastly, if you've had stem cell treatment in the last year, even if none of those criteria apply to you, it is possible for your doctor to say you're extremely clinically vulnerable anyway, because they're worried about some other combination of risks. The most common one is if you have MS and another condition. So maybe neither would put you in that category on their own, but having both puts you in that category. So I think a lot of people have been saying to us, well, none of those apply to me and I've still got a letter. It's often because your doctor's taken that kind of more nuanced judgment call. So shielding is basically what you're asked to do if you are in the extremely clinically vulnerable category. Effectively, you're asked to not leave your home if at all possible. And this is also called self-isolation, which is a term people might have heard as well. In order to support you to do that, as I think we'll come on to, the government kind of acknowledges that's a lot to ask, but basically what they're saying is if you're extremely clinically vulnerable, being in contact with a society where this new virus is circulating so much is quite dangerous, and you should stay home if at all possible. So that's right, called shielding, which is effectively staying at home.
The government has recently updated the guidance, and I was wondering if you could help outline what you felt and the MS Society felt with key changes set out in the latest government advice that people with MS should be aware of.
One key change, which we hope will start to kind of become apparent, is that the NHS is starting to go back towards normal. I think everybody kind of acknowledges it's going to be quite a while before it's completely back to normal, and there's quite understandable reasons for that. But we hope people with MS will start to find that their MS teams are a bit more available, that some appointments that were being cancelled start to resume and things like that. So that's definitely something to look out for. Another important one is around face coverings, which is distinct from face masks. So face masks tend to be the more surgical things used in hospitals, but the government's now asked everybody to cover their nose and mouth, and this could just be with a scarf, when they're in enclosed spaces like small shops. But an important point is that if you have any breathing problems, you're exempt. So anybody who's kind of worried about having to do that, you don't have to if you have any breathing problems. In England, a really important change is that people who can't work from home are now being encouraged to go into work. And we realized that this could be quite concerning for people that feel like doing that would increase their risk of catching COVID-19. So it's quite important to remember that you do have a right to continue to shield if you've been asked to by the NHS, regardless of your employment situation. And also that everybody has a right to work in a safe environment, and that's enshrined in law. So if you are worried about whether your employment situation or your getting to employment situation, your transport is safe, there's a lot more information on our website, and this will be one of the links in the description about what rights you have and what you can do. So although you're being encouraged to, don't feel sort of unduly pressured to, and kind of know your rights will be our message there. Also in England, leisure activities are a little bit more permitted than they were a week ago. And that includes things like sitting outside for longer and meeting up with one friend. This is obviously good news for a lot of people. I think the only thing we'd mention is that that does come with risks. And so even if you're not in the extremely vulnerable category, it is possible to have increased risk from COVID-19. And again, another link in the description is about risks of MS. And it's important to think quite carefully about what level of risk you want to take on as lockdown measures do start to ease a little bit. Then last but not least, the government's also committed to looking at what further support it can give to people who are shielding. We will be lobbying the government very hard, the MS Society and a number of other charities, to make sure that the government's prioritising people who are shielding for both physical and mental health support. And there's some interesting ideas out there about how you can do more digital things to replace some of the face-to-face contact that people had before. And also, I think absolutely essential is making sure that people get the same support to access food and other essentials like medicine that they've been getting so far.
How does somebody with MS who's not getting the help maybe they are entitled to or could do with, how do they go about accessing this additional help if they're shielding?
Yeah, I mean, one of the kind of nice silver linings of the whole situation is how many people have come forward to say, I want to help, and how can I help? And actually, in a way, there's almost been too many, and people have been kind of tripping over each other trying to get to the same people. The short answer, Dom, is that it does depend on which of the 4 UK nations you live in, exactly how it's best to get support. But this is all laid out on our website, so that in England, for example, there's a government website where you can self-register for support, and you'll get things like food packages. But there's lots of different ways across all 4 countries, but it would probably be a bit long to enumerate them all now. So I just point people to that link if that's okay.
So how can you maybe talk about how you feel this whole virus thing has impacted charities?
Yeah, I mean, it hit charities very hard. The Treasury did announce a bailout package of sorts for the charity sector. A lot of charities were not eligible for that initial funding, and a lot of them do need some kind of financial lifeline. I mean, I'm really proud to work in a sector where we haven't waited for that. We've just kind of charged forward, put in place new services, put in place loads of information, worked incredibly hard with less money, often less staff. We really are starting to say to the government, you've got to give us a bit of help. And we would never say, we expect them to replace every pound that we've lost. And we would never say we have a right to an income as a charity, but we would say that the people we're helping have a right to what we're doing. Thanks so much again for having me on. And just as you say, it's great that the different MS sort of charities have been able to work together, and we all want the same things. We want the best for people with MS, and I'm sure it'll continue. So thank you so much.
Hi, everybody. Well, that was Phillip Anderson from the MS Society. There's tons of links to the MS Society website, which explains some of these, frankly, slightly confusing and difficult terms, and helping you understand exactly where you fit. Also, what your rights are regarding going back to work, feeling like you may be being forced to do things that you may not feel comfortable with, etc., and understanding how it all fits in. So like the video, obviously, subscribe to the MS Reporters channel, and more importantly, see all the links down below. Cheerio, bye-bye.